Hi everyone, and thank you for joining us. I'm Pooja Shah, the operations editor, and today I'm really glad to welcome you to this special feature presented by Insights Care India as part of our edition India's 5 best rehabilitation centers transforming health and wellness in 2025. Today, we are here to talk about something that touches millions of lives, not just in India, but across the world: recovery, mental well being, and the possibility of true healing. You all know for many individuals and families, the journey toward healing often begins in a moment of crisis when things feel out of control, when silence becomes too heavy to carry, and when it's not very clear where to turn, what path to take. But imagine a space where healing is more than just treatment, where science meets compassion, and where recovery is completely personal and not clinical. That's where centers like Alpha Healing Center are working to create a place where people are not just treated, but are truly understood. And today, I'm very honored to be in conversation with two key voices behind Alpha's mission: Mr. Vijay Patel, the Chief Executive Officer, and Mr. Deepak Bohra, the Clinical Psychologist. Vijay and Deepak, thank you so much for being here. It's a pleasure to have you with us today.
Thank you.
So, yeah. Uh,
Thank
so
you.
let's
Yeah.
So let's begin. To start with, Mr. Vijay, could you please tell me about the inception of Alpha Healing Center, the driving force, and the mission and vision that has evolved over time?
Thank you, Pooja, for inviting us. And the vision and the mission of Alpha stemmed up from the fact that our MD, Mr. Dax Patel, who is an entrepreneur, and he has always been very keen and interested in behavioral sciences, though he's neither a doctor nor a psychologist. But his interest in behavioral science and contributing toward that was very much evident for last decade. And being based in US, he said, I should do something for this people who are in dire need, and there is a significant unmet need to address this. So then he decided that let me think of, conceptualizing this rehab center, where he initially started with a market research to find out that if his vision, if his idea of developing a rehab will address the need of the community. And then the place was decided once the market research showed that if such a rehab is built in India, the psychiatrist would be very keen to, refer patients, and it will be a big boon because till that time many patients used to go out of India to seek such services. And that is how the idea of Alpha Healing Center stemmed up. And the location was mainly because our MD belongs to Baroda, and he said, let me contribute something back toward the society by building up such a center in Vadodara in the foothills of Pavagadh. So this is how the concept of Alpha was laid. And the mission to, be into this field was very clear, that there are families who are struggling, there are individuals who are struggling and looking for help. So this is something which will help meet the needs of the community. And the second thing was, we always wanted to set up a organization which will win the trust and the confidence of the family who are looking for such help. So basically, these two reasons, the Alpha was set up. And today we can say proudly that after 9 years, we are in the ninth year, we have been able to achieve our mission and progressing towards it.
Thank you, Mr. Vijay, for answering that. That I must say that was a powerful start. So moving ahead, Mr. Deepak, as a clinical psychologist, how do you ensure that evidence-based mental health practices are seamlessly integrated with holistic therapies?
Okay. That's a very good question because believe me, current times have come up with people who are trying to run their own practices, secluding this therapy from that therapy, that therapy from the new therapy, and the new approaches are just coming up. At Alpha, we really believe that, see, evidence-based practices are not opposite, but they are really complementary to the holistic approaches. Like, think it about that. If a person who is suffering from any kind of illnesses comes to the Alpha Healing Center, we are not strictly putting him into any kind of algorithm based things. And it's many a times the people who practice, they follow certain kind of therapies for certain kind of people. Here we try to make tailored version for everybody. Okay, like as a clinical psychologist, my work is to ground our techniques through validated practices like CBT, DBT, trauma-based therapies, trauma-based therapies. And apart from that, within while using those trauma-based therapies, we are integrating them using the holistic approaches like yoga, breathing exercises, mindfulness techniques, grounding techniques. So this is the integrated work which works most effective for the patients, not secluding all the therapies from the holistic approaches. We don't ever, we shouldn't ever deny the importance of these kinds of techniques which comes from Hinduism, Buddhism, and the techniques that leads to spiritual leadings. That's very, very important to connect to the core values of those patients. So these interventions are very intentionally chosen for the patients who come here, and then they are layered with these new holistic approaches, running very respectively with the techniques that we are using.
It's Thank you for answering that, Mr. Deepak. It's very encouraging, to see how it's like science and holistic nature are both coming together in this thing. So moving ahead, Mr. Vijay, we have seen that Alpha Healing Center has built a strong international presence. So how do you position the center globally, and what types of transformation or healing goals do your global clients typically come with?
Thank you, Pooja. Our international presence and domestic presence, you see, both would be in line with our mission, okay, to help the families and the individuals. But when we talk about international clients, okay, their expectations are little different because all the evidence-based therapies is something which is practiced there also. Rehab centers are there everywhere in the world, and most of the people who are looking at India, they look for something additional to what they get there. And
Correct.
that is where, as Deepak mentioned, our psychotherapy as well as holistic therapy combined together really attracts the international clients, and therefore they, you see, plan to come here. Now, when it comes to international clients, the major challenge sometimes becomes time and adjustment to the local culture. But since they are looking for treatment, they are okay to compromise on all other things as long as their major goal of recovery, as well as recovery through science-based and holistic-based therapies, is achieved. So that is what attracts the international clients to Alpha.
Correct. So I can say that global reach really shows the trust that you have built internationally. So moving ahead, I guess Vijay, my next question will be for you. There's some glitch at Deepak's end, or it's fine now. There was a glitch, I
Am I,
guess. Now it's fine. Okay.
am I there?
So yeah, now you are there. So okay, moving ahead, then I'll ask the next question to Mr. Deepak. Can you walk us through the signature therapy programs that Alpha has? And also, if both of you can tell us about the USP that Alpha sets apart from other rehab centers in India.
Okay. So when we talk about our signature programs, what makes us different from the centers which I have come across and the experiences that I have taken, we use an integrated recovery program. okay, which combines intensive one-in-one therapy for the
Mhm,
patient
mhm,
alongside with group therapy, which includes life skill sessions, TPT sessions, mindfulness sessions. And while we are using the one-on-one therapy, group therapy, with the neurocognitive approaches, we are also using these holistic approaches, as I mentioned before, like mindfulness, breathing exercises, grounding techniques, and some spiritual guidance too,
mhm.
along with the patients who are compatible to or comfortable with. Okay. Like talking about a person who is going through trauma
Just a
uh, past. Okay.
Deepak,
He is going
just a
through
second. Can you
EMDR
turn your
approach.
camera? No,
Is it okay?
Now your voice is clear.
just turn it back. It's not getting stuck again.
Is it okay?
It is
We can't see
Am I
you.
audible?
No, you are audible, but now it's okay.
Yeah, yeah. So,
Okay. Am I audible now? Okay.
Yeah.
So, uh, so when I'm talking about the signature programs, which I mentioned about the integrated recovery track, which we keep, like intensive one-on-one therapies, mixing them with the group therapies and neurocognitive approaches, we are using the holistic approaches like grounding, mindfulness, spiritual guidances with the people compatible and respectively to their needs. Like think about it as a person who is going through the trauma issues and he's going through the EMDR techniques for the trauma problems using the neurocognitive approaches. We are layering them with trauma infused yoga techniques. Okay, only those we use very sensitively these techniques in order not to mesh or mess with the previous traumas that the patient had. We keep them in keen consideration what kind of holistic approaches should be used with these trauma patients. Okay, so if you talk about the USP from the clinical side of view, we are not treating patients, the problem patients. We don't see them as problem people. We see them as people with problems. So we are not just going to treat their diagnosis, rather we are going to turn them completely into a new personnel with whatever he had before that addiction hit him or before that mental illness has hit him, rather trying to do the overall personality development, changing him into a whole new person who will become more closer to the loved ones, who will become more closer to him himself with learning new emotional resilience, emotional regulation, self-confidence, you know. Yeah.
so moving ahead, Mr. Vijay, do you wish to add something regarding the USP?
What Deepak mentioned on the therapy side, which is absolutely true, but few other things which I feel really differentiates Alpha from any other center is uh, we are a voluntary center, and it is a well-known fact that nothing can be achieved by force, you see. So when we say voluntary center, means the individual comes with his own willingness, motivation. He gets the freedom to express, he gets the freedom to discuss his problems, and whatever is being discussed, there is 100% confidentiality. So nothing is being disclosed to anybody without his permission. This is one. We have electronic medical records, so the chances of leakage and all is less. The third thing that I would say, which really differentiates Alpha, is our team of therapists and psychiatrists are very, very experienced. We have two MD psychiatrists. One MD psychiatrist is 24-hour based at center. 24-hour based at center. So at night, if there are any challenges which crop up, we have somebody who can address this. Okay. All our clinical psychologists, which Deepak heads, are MPhil and RCI registered. Now, these are small things, but these really add value when it comes to
Yes.
recovery, you see. And the last thing that I would like to mention is that our therapeutic approach along with our evidence-based practice is backed by a whole lot of extracurricular activities, which helps to build up the person's self-confidence and self-esteem. We have lots of activities post 4 p.m. like organic farming, swimming, cycling, cricket, badminton, gym, volleyball, table tennis, all this under one roof. So definitely a person does not only get an opportunity to recover through the therapies, but at the same time, he remains active post 4 p.m. and therefore when he goes back home, you see, he is not only recovered, but he is integrated back into the society like a normal person.
Correct. Yes, that's very integrative approach, and that definitely makes Alpha stand out in the industry. So moving ahead, Mr. Vijay, what were some of the early challenges? And this question applies to you as well, Deepak. I'm sure you must have faced the early challenges, and there could be some story that you can relate to that has impacted you all. So, could you please share with us the challenges and the story?
Uh, the initial challenges when we started Alpha in 2017 was
Mhm,
there was a lot of social stigma which now has reduced, that whether rehab really helps. After coming out of rehab, will a person stay sober? Will the investment of time and money that we have made will result, or these lapses will keep on occurring and there is no end to it? Okay,
mhm,
so these challenges are such that there is no 100% answer. We can never say that a person who comes to a rehab, once he goes out, he will be able to, you see, sustain his sobriety. But if he
correct.
comes for follow-up, he follows the advice of the therapist that has been given, complies to the medicine, the family supports as advised by our therapist, then obviously, you see, the chances of success rate are very high. In
Correct.
medical science, we don't have guarantees, we have success rate. So these were the initial challenges. But
Mhm,
right from day one, as I said, we have been very transparent, and the entire Alpha setup has been on trust and confidence. So now, over a period of 7 years, we can say that the challenges that were there initially are slowly coming into, you see, shape, and people are realizing that yes, by you see, uh, residing that confidence in a rehab center, they can definitely help their family member come out of this problem.
yes.
So these were the initial challenges that we came across.
Correct.
And regarding the story, I think maybe I will share it in a very short thing. We had a very unique case of a young client outside India who who had been to one of all the best rehabs in the world and was still not able to sustain his sobriety. So as a last resort, they found out Alpha. They heard from somewhere. They came to our center, and he initially came with lot of resistance, and the family also were not sure because they felt that they have tried everything best in the world. Now, what is that Alpha can offer us? You see, and when the client got admitted at our center, initially he came for 1 month, then he extended second, third, fourth,
Mhm,
fifth, sixth. After 6 months, till 1 year back when we followed up, the individual is sober, is back with the family, the entire family is happy, and he is a changed person today. He has now become an advocate to others who are suffering from this, to advise them that you see, you should seek professional help. So this was a very interesting story where the family has tried all the avenues, and then they came to Alpha with a hope, and we could help them.
it's very inspiring. Deepak, would you like to add something on this?
I've been of last 3 years. And if you ask about the early challenges, it is like first is an early therapist because people have usually worked on with people who come meet them once, okay, and you're not in contact with any of your patients within that period, or if twice a week if it's an intensive therapy. With the IPD setup, the it's a boon too, it's a problem too sometimes for the therapist that we connect we connect with the patient too deep that they start impacting our lives too.
True.
No matter what you say, that
Yes.
what kind of job or profession is this, that you just have to sit and listen to the problem. Believe me, I have dreamt my patients when I hear the stories and when they are too touching, because in the end, you are a human. Okay,
Correct.
so the early problems that come as a therapist, uh, not as a center, I would say, as a therapist, I would say that anybody who joins the center, he has come from a setup completely different from this IPD setup, because people stay here for long. And every alternate day, the patient has a session. So we make a connect and that bond in order to move alpha away from the corporate sector and bring in alpha touch. It's the alpha personal touch that patients feel with the therapist, that connection that patients feel with us. And within that, with that touch only, we have to accustom ourselves to the changing lives of people. We have to accustom ourselves to this new kind of therapies, because we have to meet every alternate day, read about the cases. Every new approach has to be developed, explored in a new manner. And this only makes the news stories too. Every day there is a news story. Believe me, I do not know how many lives would have touched mine. And people who are suffering from addiction, and it's such a helpless condition that if you will know about if somebody develops a cancer, nobody blames him that how can you develop a cancer, why did you develop a cancer. But when you develop an addiction,
Yes.
it's exactly the
Everybody.
opposite. How can you do that? Why did you do that? uh, did you not think about us? And when they come, they cry. The first thing many a times is like, you will not be able to control your cries with them. That's the basic counter transference you reach many a times in the therapies. And when these things happen, a very recent case who did so well, multiple relapses, multiple therapists, multiple psychiatrists, and hopelessness, helplessness, came literally kneeling and begging for help, because family has lost the trust, patient has lost the
Mm-hmm.
trust in himself. So when we try this consistently evolving approaches at Alpha, because we have patient for longer run, so that patient completely uh, changed his lifestyle, got closer to his loved ones. That family started building that trust again. Everything started by at a new set. It's a reset to that life. And now when you look at those people who have relived those lives, and they are doing so good, their family have started strengthening, it's all healed now, then there comes a feeling that this profession is a good one. So there are many
Yes.
stories, but these are some of them.
Correct. That's also truly moving when you can relate with the patients. You can feel their stories. It's like you're living their story, which is not very, happy, which does not have a happy start. But I'm sure coming to Alpha Healing Center, they'll definitely have a happy ending with that. So moving ahead, this question is for both of you, Vijay and Deepak. We all know that Alpha Healing Center is known for emphasizing voluntary admission. So, how do you handle those situations when families seek involuntary treatment for a loved one, or who isn't resistant, or who is not ready for this? So, what is your approach to such sensitive cases?
Okay. The initial discussion that happens is between me and my colleague Pooja
Mm-hmm.
with the family, because when they first call us, you see, we seek basic information. And as you rightly said, if the patient is not willing, and as we call them in denial, okay, so initially we try to understand what are the barriers, you see, that is it he has a feeling that in rehab they will not be treated properly, or is it that he has been to rehabs and he continuously lapses, or is it that how will he spend his time. So based on the barrier, then we ask the family to speak either to one of our therapists or a psychiatrist, because when it comes to the technical side, then we it is better to seek advice from the experts. But if the patient has a barrier in the mind that, you see, after going to rehab, as I said, treatment aspect, logistic, how will he stay, all that we address. And then as a matter of support, we tell them, okay, let's do one thing. If these on the logistic side, if you have any challenges, come to Alpha, stay for 5 days, see for yourself. If you are happy with the 5 days treatment, then you can continue further. Our team will put all the efforts, you see, to convince him. But if after 5 days he feels that no, I'm not comfortable, he has the freedom to go back and you see, pursue whatever further treatment they want. So in this way, we help the family to, you see, bring down the barriers and convince him. But there would be many patients who still after this would not be willing. Then in that case, our psychiatrist and therapist advise whatever the next course of treatment they should follow.
Okay.
Deepak, anything you want to add?
Yeah. So actually, rehabs don't have a good rap in India. Okay. As soon as people hear about rehabilitation, the first thing comes is a prison. Exactly the prison like
Yes.
feelings, because they have heard from their friends, they have seen in movies, but they have never had this feeling like Alpha Healing Center before. They have not known that something like this also exists. So whenever the conditions come when patients are in this dilemma to even think about coming or not, we try to consult the patient over phone and try to give him a new perspective of how to look at this rehabilitation in a new manner. That how are we different from those approaches of the patients? And there are sometimes there are very narrow spaces for us to build that trust over phone.
Mhm.
That if we are able to crack that particular area of that patient's perception, many a times patients rely upon those phone calls, come to us and give us that opportunity to help them out. Apart from that, if the patient is not feeling and there are some other issues that the patient is still enjoying the substances, is not in his cognitive level to define what's right and what's not right for him, we do just advise the family to go for involuntary admissions first, so that the patient comes out of those withdrawals. And then we offer them that after the patient is into his cognitive level of decision making, we can offer help before he goes to his house.
Mhm. That's very thoughtful. So thank you for answering that, both Vijay and Deepak. Moving ahead, Deepak, my next question is for you. What role do family members and caregivers, according to you, play in the recovery process at Alpha? Do you offer any structured programs or counseling sessions specifically for them?
See, the main part, as I told you, like mentioning those integral approaches which I mentioned before,
Mhm.
those integral approaches, apart from the family, apart from the individual therapy and group therapy, we do have proper structured family therapies for the families of the patients, because see, that is the real environment that we have to send them back to. Okay. And all these things, if you go towards the Freudian aspect of psychology, it starts from the family itself. Okay. The
Yes.
broken families leads to broken people many a times. uh, I would say more than 80% of the times. So when we don't have that proper support, like families have been treating the patient, like parents have been still treating the patient as parents. Okay. Rather, at the times of those vulnerable phases where they should take the role of a therapist, we train them to become a therapist when they come to us, when they ask for the help. With helping the patient, we help the family of how to become a secondary therapist at home, how to consistently being in touch with us whenever the patient loses his control, whenever, because slips may happen. If patient has come to us, there is no 100% guarantee that he will go back and never ever do it again in his life. But if he slips, we tell them how to see it as a, as you will see a physical problem, not
Mhm.
mental health problem becomes the core responsibility of the patient himself. Rather, it is a combined responsibility of family plus the patient. So we do have that approach where we put the family exactly near the patient, very well served in a similar way. Like we use therapy for the patient, similarly we use therapy for the patients, for the patient's family too, not just the patient. So if families are helping us in the initiating processes and they maintain with us throughout the therapies, believe me, patients are their healing becomes multiple times faster.
Yes. Yes. So, and it's also great that families are included. They'll understand the journey, the healing journey, especially what the person is going through. So, yes, moving ahead, Deepak, again, my question is for you. We see, like you have already mentioned, I guess Vijay has also mentioned that Alpha Healing Centers offers a wide spectrum of treatments from RTMS and neurofeedback to CBT, yoga, and biofeedback. So, how do you determine which therapeutic combination best suits an individual client?
See, as we mentioned before, we are using integrative one-on-one personal
Mhm.
therapies along with the medications, evidence-based medications, evidence-based therapies, evidence-based holistic approaches. Whenever a patient comes to us, we have proper assessments for them, where we diagnose the patient first, aligning with the licensed psychiatrists and reaching a common ground to medically help them and adjusting those medications within the IPD setup for as long as the patient is here. Similarly, along with that thing, we have clinical rounds in the morning where we
Mhm.
discuss the patient's current status, where psychiatrists lead us to a conclusion that what kind of therapy should we go with, as in they tell us the condition of the patient and we align the therapy according to the status of that condition, status of that patient. And along with that, now we are using the individual psychotherapy. Like if the patient is having very rigid cognitive distortions, we will use CBT with them, along with knowing if they are going through a depressive state, applying the depressing scales upon them, knowing the level of depression they are into, maintaining a common coordination with the psychiatrist who will help us in medically uplifting those depressive symptoms. And if they feel very important, along with these medications, we do go with the RTMS, okay, which is the very old approach, which is helping patients in a
Mhm.
numerous ways. And along with that, neurobiofeedback aligning with the approaches of like neurocognitive therapies. So we are using it to show it to the patient that how is he progressing throughout the approach. And it's a
Okay.
tailored approach. We are using all the
Correct.
approaches are tailored. We do not use that one set goes for all. Every patient, the therapy is intentionally chosen for him especially.
Mhm. So, adding more to it, could you please elaborate on the range of conditions Alpha Healing Center treats, whether it's substance abuse, behavioral addictions, mood disorders, or dual diagnosis, since you have already mentioned that it is tailored to individual diagnosis. So, how do you ensure that?
For the longest time,
Mhm.
patients who have come here, we have treated all kinds of patients. It's not just one criteria.
Correct.
See, if the patient is coming here for even an addiction, okay, he is not coming here only with the substance, he's coming here with his own personality deficits, because of which that addiction has come into play. Addiction is just an escape from the reality. Okay.
Right.
So for the long period of times when people are going through these kinds of issues, so just consider him a case of everything, like addiction, along with depression, along with anxiety, along with induced psychosis levels, where schizophrenia hits. Many a times there are cases of complete, proper patients with personality deficits, patients with not in the oriented, not even oriented to time, place, person, okay, not even oriented to the reality. So we have all kinds of cases from all domains.
Thank you for that overview. And I guess it's a very relevant and optimistic outlook that you're following, that you have tailored strategies and diagnosis for every individual patient. So I guess I have just last two set of questions. And these two questions are for both of you. So Mr. Vijay and Deepak, I want to know for individuals or for families who are just about to begin their healing journey, what advice or what call to action would you offer to encourage them to take their first step towards recovery?
Uh, Good question, Pooja. Whenever a family identifies that there is a problem which needs management beyond, you see, advice, beyond counseling at home, There are a lot of other factors which play in the mind. The family is already into a panic situation because they seek help from their friends who might be giving, you
Right.
see, various advices. कि घर पे ठीक हो जाएगा. You see, let him give him some time. He will come out. Let wife make him understand. Visit a psychiatrist. Visit a counselor. When all these efforts are done, the family is in a mind frame or in a confused state what to do, you see now, because some people would have advised there is no need of a rehab, or even after coming out of a rehab the person remains same. So my one advice will be that, you see, instead of going to or following the advice of all, only follow the advice of the expert, whether it is a psychiatrist or a psychologist. They are the people who have treated thousands of such similar cases, and they will be giving you the best advice. And when you talk to them, you have absolute transparency to discuss all the issues that you are facing. And it is the right to ask a psychiatrist and psychologist that, and they will be guiding them accordingly. Because one wrong step in such a direction not only will impact the family, but it will also impact the long-term recovery of the patient. You see, like taking him to a Ayurvedic center or taking
Mhm.
him to a center which is not recognized and spending 10 days, 15 days, where the individual comes out of a rebellion attitude. And then the family says, oh, there is no point in sending to rehab. No, first you seek the advice of an expert, psychiatrist or a psychologist, and then follow what they advise. So this is the only advice that I have.
Thank you for that strong message, I guess. And Deepak, would you like to add yours?
First thing, remove the stigma of mental health and mental health illness and mental health recovery. Like these are the times when people are themselves without consultation from any doctors go for a physical checkup by themselves just to avoid any future complications, like going for a blood checkup, going for full body checkup, so that in future there is not a problem which affects them or affect their families. Similarly, see, going for a therapy when the situations have gone worse, it makes even mental health also a very complex process. This recovery also a very complex process, very similar to going to a doctor at a stage 4 cancer. Okay, just denying all the basic and forefront signs when you are already seeing them in the first place, and still the people are trying to treat them in the house, that trying to change the way they trying to change the person should be treated, being harsh, being soft, trying different approaches. But it's the last part, that after the faith healers they will come to us. Okay,
Right.
still they will still go to a temple first and then come for a mental health specialist later.
Correct.
And even after taking from us, they will first visit the temple and then go home. So it is doing nothing but encouraging the wrong sides of the mental health recovery. It is going to worsen the case. It's not going to help them. So
Correct.
the first thing is remove the stigma,
Mm-hmm.
take the precautions rather than waiting for a cure, and try to have an empathy very similar to a psychotherapist. Sometimes try to see your son as a person, a human being. Try to see your brother, your sister, not as just a family member, but as as a very separate human being with a very separate brain, with a very separate soul, with a very separate body. And then you will get to know that where their mental health conditions are going.
I guess that's a very strong message from both of you, especially for the ones who are looking forward to take their first step to the healing journey. And I guess this is one last question from my end for both of you again. We have already talked about advice, challenges, and everything. But the one last thing, what I want to ask you is, what message would you like to give to the people who are still hesitant or kind of ashamed to seek mental health or addiction support?
I think this question would still exist and will continue because, as Deepak mentioned, the stigma part, because even after so many options available, if the individual is still not willing to, seek advice, uh, the role of family member comes here, because a family member can contact a expert psychologist or a psychiatrist and discuss that what challenges are going on in the mind of the patient, because the patient is not willing to talk to a psychologist, psychiatrist. So if the family member can take that initiative and not give up, and then sit with the, patient to explain as per the advice given, that is one advice I will give you, give the family. The second thing will be, the family also should put themselves in the shoes of the patient, because the patient is suffering from some trauma, addiction. Tomorrow it could be the individual family member itself. So right now he is beaten on all sides, and the only thing that can help him is provide an emotional platform. Don't jump to assessments, and give him all the help and support. Don't be in a haste, that come on, let us go and do this and that. Be empathize with the patient to understand, and then slowly, you will be able to find solution.
And Deepak, would you like to add something?
The only message which I feel and I keep giving my patients is, when all situations go hopeless, when everything seems dark and the pain cannot be forgiven, cannot be forgot with time. Believe me, there is no need to forgive and forget the pain. Come to us. We will give you a reason to smile. We will give you a new reason to stand up. We will give you a new reason to see those pains as learnings and wise incidences rather than bad accidents of your life.
So thank you for that empowering message, Vijay and Deepak. Before we wrap up, is there anything else you both of you would like to share with our audience? Perhaps some important information about Alpha Healing Center or any upcoming initiatives or any final thoughts?
I think the commitment that we have made to the family patient, the mission and the vision with which we launched Alpha, we will ensure that, we live up to those expectations, and try to improve as much as possible, whether it's new therapies, new advances, whatever best available, we can always try to integrate and introduce at Alpha Center, and we'll continue to, win the trust of the patients and the families, and provide the best options to the patients who need it.
So, Deepak, would you like to add something to it?
So the last one thing which I would like to add, being the part of this center, and it has been 2 years where I maintained, and because the one reason for me to maintain being in this center is, it it's very different from a corporate sector, and we are having Alpha. Being at Alpha is like being with a family. You know, it's not having those corporate guidelines where we run through rules and regulations. Rather, we give a very free hand to the therapist to apply all kinds of approaches, management to deal with the patients differently, doctors to deal with patients differently, and we live as a family, we treat as a family, even the patients feel as a family.
Thank you so much for sharing that. And I guess with this, we'll wrap up today. So, thank you once again, Vijay and Deepak, for taking the time to share your valuable insights and experiences. It's been truly, truly inspiring to learn about the incredible work Alpha Healing Center is doing to transform holistic health and wellness, not just in India, but beyond. So, to our viewers, we hope this conversation encourages you or your loved ones to take that important, very necessary first step towards healing and recovery. So we always have to remember that support is available and seeking help is a sign of strength. So thank you all for joining us today and wishing everyone good health and wellness ahead. So for more information, please visit alphahealingcenter.in. Stay safe and take care.
Thank you, Pooja.
Thank you. Thank you, Pooja.
Bye.